Hariom everyone, I am Sobita, a member of Panchajanya. I welcome you all to today's session, 30th session of lecture series Pragna Varti. Before we move into the section, I would like to introduce our organizing team Panchajanya. Panchajanya, the divine conch of Bhagavan Sri Krishna, which was blown during Kurukshetra, indicating the start of the Dharma Yuddha that followed. There, all the efforts were done for the establishment of Dharma. Dharma was kept over personal relations and motives. Keeping the same motive in mind, our organization will work towards establishing the importance and necessity of following and imbibing Bharatiya culture, accepting our root, and making people realize the true essence of Ayurveda, not only as a treatment modality but also as a way of life. All these while walking in the path of Dharma. Hence the motto Shreyam Bharatiyam Arogyam Ayurvediyam. The founder of the organization started this because we felt the need to spread the knowledge of Bharatiya culture, Ayurveda, the true history of Bharat Rashtra, and value to all strata of people in every corner of the world. Also, the founder, being Ayurveda aspirants, know the inside out of today's medical field. Hence, they aim to make people aware of this and also try their best to solve this on the go. Our main goal is to reach every individual in creating awareness of our ancient knowledge and wisdom, its efficiency in the modern era, and link with current ongoing affair. Its revival, and most importantly, bringing everyone together in working towards establishing a strong system. In order for all this to be achieved, we have set up various wings with working principles and objectives that help achieve the goal faster and easier in the coming years. They are Ahilya Bai Wing, Swami Vivekananda Wing, Karnata Bala Wing, Govardhana Wing, Ashwini's Wing, Narada Wing, Kautalya Wing, Vedavyasa Wing, Nalanda Wing, and Sanjaya Wing. Today, we are really honored to have Vaidya Chaithra ji. Ma'am has done her HOD of ma'am is currently working as HOD of PG studies in Agada Tantra and HOD of Ayurveda Dermatology, SGM College and Hospital Udupi. Ma'am has done her PhD for the thesis Critical Appraisal of Dvivida Virya. Ma'am has 17 years of teaching experience, published 52 general articles in various magazines and newspapers, received Best Paper for 3 presentations in National Seminar, Certificate of Appreciation for Best Research Paper from Dr. P.D. Seth's Memorial National Award. We are really honored to have you here, ma'am.
Thank
Ma'am,
you.
you may take over the session right now.
Yeah, thank you. And
Thank you.
I'm very honored to be here with Panchajanya team, and especially because of your noble thoughts and noble intention. And
Thank you, ma'am.
this session, I think it is dedicated to the third year BMS students who will be
Yes, ma'am.
facing the examination
Yes,
very
ma'am.
shortly. And of course, because you have recorded the video, I think it will be also a credit for the future juniors and maybe even the PG scholars. Of course,
Yes, ma'am.
the
Yes,
session is
ma'am.
typically UG oriented. So,
Yes,
and
ma'am.
the intention is to face the examination and pass with a very good marks. So, the slides are pretty oriented to the UG audience. So
Okay.
today I will take up. I will be speaking about 10 vegetative poisons. As you all know, Agata Tantra is a subject which is oriented to the poison study. Poison, in the sense, it can be in any form. It can be in the vegetative form, or it can be placed in the chemical active agent chemical, which is really a chemical which may be possessed independently apart from the organic resource. But today we will concentrate on vegetative poisons. So, first and the foremost, let us concentrate on the narcotic drugs, that is, the one which is going to give the sleep and also which will be giving an associated type of a symptom, that is the analgesia, because people, why they are liking this narcotic drugs, because it gives a relief from the pain. So at the same time people will be having sleep also. That is the reason these drugs can be the drug of abuse, or what can be told as the one which can be addicted as well. So the first of all, let us concentrate on Ahifena. Ahifena, as you know, it has entered our Indian land after Alexandrian attack on this country, or his entry to this country. And the concentration here mainly focused to what we require to write in the examination. So these questions, the questions which will be asked about the vegetative poison, mainly, it is viva oriented or practical oriented. So you have theory and practical, right? So the theory will be having the longest, say, like it can be 10 marks, or it can be 5, or it can be 2. So here, what happens is, very rarely they may ask you about the vegetative poisons in the 10-mark question, but it can be there in the short essay as well as the very short questions. And very importantly, to pass the viva, you need to concentrate on these vegetative poisons because it is the one which will be there in your spotting, wherein you have to identify the specimen. You may have to write about the medico legal importance, fatal dose, and fatal period, etc. So that is why it's very important you take over the whole of the practical marks in your examination. So for that, and also, whenever the oral examinations are also done, there are chances that the examiner will be asking you about the identification, and some cross queries may be there from their side. So the student has to confidently identify, as well as, very importantly, you have to be in a position to answer whatever related. So Ahifena is named as Papaver somniferum. See, narcotic means, as I told you, it is sleep oriented. So here, somniferum means which is going to induce the sleep. So this should not be a problem to remember. So, and it is Papaveraceae. So Papaver somniferum and Papaveraceae, it should not be a problem to remember this botanical name and the family. The synonym, it is oriented to the Niryasa, that is Apoka, because the Niryasa, or the exudate, or the milky fluid, what is coming out of the unripe seed capsules of the white variety of the poppy plant, that is what is used here. That is why it is called as Apoka or Khasatila, or it can be Tila Beda Kakasa. So Kakasa is oriented to the seeds as such, not, and the seed, it is usually people tell that it is not poisonous, but actually it is having some amount of the morphine and the codeine. So little bit of the morphine and codeine will be there. That's why Gasagase Paisa, it is called in Kannada. So Paisa is made, isn't it? Gasagase, it is called in Kannada, and Paisa, it is made usually. And this particular cuisine, it can induce the sleep, and that is because little amount or less amount of the morphine and codeine will be there. So that is about the seeds. But here, what is used is the Niryasa, and it is dried part of that particular exudate. And as you can see here, the black color or brownish colored irregular mass which is there. So it will be having a characteristic odor also and bitter taste. So of course, nobody is going to keep this aphema, opium, for your examination, because it is banned as such to be there in your museum also. So because under the license only, it is cultivated by the government permission itself. And India, it also produces 70 to 80% opium, and the purpose is for pharmaceuticals and therapeutic use. Like, you have different components like morphine, codeine, pethidine coming out of this particular plant. So this is a very good plant, which is 1 meter height, and it's nicely branched. And people also leave it to drying. After it is, usually it gives its flowers and fruits. The people also leave it for drying, and that dried part as well is used in making up of these narcotic substances. So that is about the introductory part. Later, you should also remember which varga it comes. So you have this in Dipaniya Gana, Kustagna Gana, Mutra Sangrahaniya Gana. Sushruta tells it in the Nyagrodadi Gana, Mustadi Gana. Bhav Prakasha speaks about in the Haritakyadi Varga. So because see, Vargas usually are not asked in the Agada Tantra area, but still because it has some therapeutic importance, because after Shodhana you're using it for the therapy, you need to know something about this as well. But very rarely they will ask you about the Varga. And rasa panchaka is also very appropriate when it comes to the visha dravyas. Almost every visha dravya will be having these things in common, like it will be either tikta or katu, very rarely kashaya as well. And guna, it will be lagu ruksha sukshma, because it will be having this vyavayi vikasi properties, all the dashagunas of the our visha. So in that way, all these dashaguna, highlighted dashaguna, especially lagu roksha, ushna, sukshma, vyavayi, all these things you can name as well. And vipaka, usually all the visha dravyas will be cut to, very rare. You have the madhura vipaka, and virya is ushna. So usually almost all of the visha dravya will be having this. So the student should not make mistake in this rasa panchaka. And karma is typically oriented to the drug what we are going to discuss. So this opium is considered to be shukra stambhana. So previously also the addiction of this particular opium was because of the desire. So otherwise also therapeutically in Ayurveda Shastra, people are using it for the shukra stambhaka activity. And vajikarna, you can match all this, isn't it? Karma and rogagnata, all this you can match. So when you're telling shukra stambhana, automatically mind should go towards the vajikarana karma which is associated. And you should think that the person should get a very good build or maybe immunity, etc., etc. In that way, it has to take care of all these atisara, kasa, all these daurbalya, all these things, which is in the kshaya avastha. Whenever the patient is suffering in the kshaya avastha, such things has to be remembered, and the student can tackle this question easily. And apart from that, you can see here this particular capsule which is coming, which is yielding out, or wherein the exudate is coming out. And this particular person also, he is trying to put an incision on that particular fruit or the capsule, and that exudate is coming out. And these are the plants, and these plants usually kept for drying also, and the codeine, morphine, etc. activities can be yielded from the same. Coming to the chemical composition, alkalides. So usually why we are so much behind this visha dravyas, when it comes to the plant has a primary metabolite and secondary metabolite. Usually, when it comes to the therapeutic activity or maybe the visha activity or poisonous activities, our focus is on the secondary metabolites. When you tell secondary metabolites, we have a n number of things or composition in a plant, starting from the alkalides or maybe the coumarins or maybe glycoside, etc., etc. The list will go on. Usually, when we are telling it is a visha, we have got lot many alkalides present in it. So usually, alkalides and the glycosides are more concentrated in the visha. And you should know, whenever any question is there about the chemical composition, you all have to concentrate on this particular alkali. So we have two words here. If you have come across in the text, you get two words. One is opiate and another is opioid. So opiate means it refers to the natural and semi-synthetic derivatives of the plant. Okay, opiate it is. Okay, opioid means it is something which is usually it can be something which is synthetically produced. So opioid can refer to something which is synthetically produced, or any agonist and antagonist morphine like activity. Agonist antagonist means agonist is something which is positive, antagonist is something negative. So many a times what happens, this the opium composition, it will be having this both type of the activity. It will be agonist as well as antagonist. So in that way, the synthetically in laboratory we can prepare the medicines or therapeutic agents. So natural derivatives, you can divide it as two things. One is phenanthrene group and benzyl isoquinoline group. So phenanthrene group means morphine, codeine, thibin. See, all these, I think these words are very, very commonly used even by a common people. They will be knowing if any pain relieving or, usually a pregnant lady getting pains. So usually this is a very common type of the terminology used by the common person also. So morphine is, I think, very much known to the society. So benzyl isoquinoline group, it is having a component like papaverine and narcotin, etc. And you also have the semi-synthetic derivatives. To name one very famous, I think you can remember heroin, isn't it? Heroin. So these heroin, why this name? So there is again a big story there because it was considered to be giving uh, or giving positivity to whatever bad effect which was given by the morphine, etc. Okay, whatever natural derivatives had given to a particular person, even though therapeutically used or maybe addiction used by the addiction, the this particular component when it was synthesized, semi-synthesized, this component was overruling the negative impacts of morphine, etc. So it was considered like a heroin. Okay, so but later the word was carried on for this particular component, and that is how the name is kept as it is. And people are again addicted by this particular heroin. Synthetic derivatives to name tramadol, okay, loperamide. Loperamide is very, very, I think people will be knowing it as an anti-diarrheal, isn't it? So, or pethidine, which is helping in the cough, exact, etc. So, in that way, you will be knowing it, but the only thing you need to know here is all these other components which are present, in our opium. Okay, so, and how to identify? So, in the Viva, or maybe when you are writing your exams, you'll be getting one question like what it is, what type of poison it is. So, you will be knowing it as narcotic or neurotic type of the poison. Narcotic poison means, as I told you, it is going to induce the sleep and it is also going to give the analgesic effect. At the same time, it will be having some neurotic type of the impact also. Very important here is you have to write the fatal dose and the fatal period exactly. So here, 30 to 75 grains in the sense it can be 200 mg morphine or 2 grams of the opium, which will be fatal to a particular person. It's a very minimum dose actually. So you need to know about this. And fatal period, it is 45 minutes to 9 to 12 hours extended to 2 days. So many a times the students do mistake with this fatal period and fatal dose. That should not happen with you people. Try to remember it. It's only the game of memory. Actually, you have to just memorize it. Make a table of all these dravyas and fatal dose and fatal period. You can columnize it and you can remember it. And uh, many a times what happens, whatever the symptomatic signs and symptoms it is going to produce, you may have to differential diagnose it. So in the differential diagnosis, some other poisoning also look alike. For example, alcohol poisoning, carbolic poisoning, op poisoning, all these are going to look alike. Coming to the signs and symptoms actually, so here, how it happens, how opium can be giving rise to the signs and symptoms. Usually it is because of the therapeutic overdose, accidental overdose, because as I told you, one is it is addiction drug, and that is how people start eating it little by little. They may increase the dose also. So that is how the symptoms and signs will start appearing. and usually half to 1 hour after the intake it will start to appearing. And more time will be there whenever a solid opium is taken than the solution opium. So this solution opium will give more symptoms rather the solid opium. And then also whenever it is taken hypodermical injection also, it will give rise to the symptoms immediately. One very important thing to remember here is about the acute poisoning. Three stages are there. Okay, opium, as you know, it is a narcotic drug. So, stage of excitement. Why people are addicted? Because it is going to create the excitement. And stage of stupor, stage of narcosis or the coma. Stage of excitement means what? People, that is what is that is the euphoria. Euphoria means false feeling. So it is sense of well-being, feeling that I am very happy, etc., etc. Increased physical and mental activity will be there. Person will start talking like anything. Restless, he will become restless. And different type of hallucination like visual, some images will be appearing in front of him, or some mental hallucinations will be there. And his thought process is not proper, and he starts with tachycardia. And there will be as if all whatever anxiety was there in his life, everything has vanished. So that is the reason why people are getting addicted to this particular opium. The face also will be flushing, and there will be convulsions, especially for children also people were giving this opium because they want to make it sleep. They don't, the parents or maybe the child keeper, the particular caretaker, they want to see that they are free from this particular child. So they don't want any botheration from this particular child. So they want to make it sleep so that they can do some other activity. So previously people were giving this opium for the child also. So the child was sleeping, and overdose many a times can create the convulsions and all these considerations. And next stage of stupor. So this stage of excitement should not be a botheration to a student. You have to remember it. Stage of stupor is the second stage, few minutes to an hour. The person usually is brought in this particular stage. So initial stage, people will not be so much, thinking that the person, there may be something wrong with him. But when it comes to the second stage, he will be brought to the hospital. And here you see that the nerve centers are depressed. The person may have the diarrhea, or maybe giddiness, vomiting, nausea, headache, lethargy, body heaviness, drowsiness, fatigue. And many a times he is feeling very, very sleepy. He just cannot control himself. And sinused face will be there, lips will be there, and contracted pupils. So very important. See, the contracted pupils are typical sign of the opium. Whenever any examiner asks you what are the triad of opium, you have to tell coma, pinpoint pupils, and respiratory depression. Coma, pinpoint pupils, and respiratory depression. These are the symptoms and the signs usually seen in the particular person who is affected with the opium. And next stage is the stage of narcosis or the coma. And when, if at all he goes to this particular stage, you cannot arouse him at all. So rather there will be they will not have any feeling towards whatever reflexes, so maybe the pain reflexes, etc., because they will be having the relaxed flaccid muscles, diminished reflexes will be there. And usually cold clammy skin will be there. The face will be pale livid, lips will be there, dropped lower jaw, pinpoint pupils again, as we have already told about it. And labored respiration, and falling BP, etc. Okay, and the smell, very typical is whenever you are going near the particular patient, you have that opium typical smell. And sometimes they may be having purging, they may be having vomiting also, which is continuously happening in the patient. And some convulsions can occur, dilated pupils. Sometimes, always it is pinpointed, pin pointing of the pupils. But sometimes whenever the patient may be near to the death stage also, you can see the dilated pupils as such will arise. And also syncope and the heart failure can be the phenomena which will be there for the death. So ultimately, these are the three stages of opium poisoning: stage of excitement, stage of stupor, stage of narcosis. And chronic poisoning is another thing. And acute poisoning can happen because of the overdose of whatever medicine the person might have taken, or maybe during the addiction, he is addicted, he is taking something, and suddenly he takes the overdose. So such things happen with the acute poisoning. But when it comes to the chronic poisoning, this is because of the addiction itself. Like gradually, there is the accumulation of the drug in the body, and the low excretion will be there of the same. So accumulation is more oriented here, and the person will start with, gradually he starts with all these symptoms. Like there will be mood swings, depression alternating with the euphoria, withdrawal from the family, friends, social activity. And very important, here you have to think about the other side of the picture. That is, the particular person can have the needle marks on his body parts. Maybe dermal scars will be there because of the repeated injections. Pinpoint pupils, as I have already told you, anorexia, constipation, weight loss, pallor, amenorrhea, confusion, hallucinations, impotence, and periodic withdrawal manifestations, sweating, tremor, etc., etc. So all these are very importantly present in the particular person. And the management as such, what happens? We have to, once we are diagnosing the patient as acute poisoning, we have to see that we maintain the airway. All these are very common to almost every poisoning. You have already read the general treatment, what has to be adopted whenever the poisoning is there. The same thing we have to do here also. We have to maintain the airway, stomach wash with the warm water, and potassium permanganate water can be used for stomach wash. Also, the active charcoal we can induce, and bowel clearance we can make with the magnesium sulfate. Whenever you are telling magnesium sulfate, it means for bowel. Potassium permanganate means it always orients to the stomach wash. So in that way, you have to match these drugs and you have to remember. And antidote of choice is the naloxone. So you can go for the naloxone. This thing, introducing the naloxone, and also oxygen can be supplied. All these are the very general thinking of a doctor whenever the acute poisoning comes. And chronic poisoning, as you already know, addiction, because it is a drug of addiction. Withdrawing from that particular drug is very, very important. For that, how you do it? You have to taper the dose. And when you are tapering the dose, you have to give a substitution therapy. So substitution therapy by the methadone. So here 30 to 40 mg per day is given, and that also is gradually tapered off. So in that way, the and anti anxiety drugs should be given, and anti spasmodic drugs, etc., also should be given, and counseling, etc., has to be done. All these things. So all these will be helping for tackling the opium poisoning, both acute and the chronic poisoning. See, whenever I'm telling about the needle mark, dermal scars, etc., you should also concentrate about the tattoo. Okay. Whenever the patient of drug abuse or addiction comes to you, you have to notice the body. You have to notice the body parts. Also, you have to hunt for the tattoo, because what happens? People are going for the tattoo marking just even for hiding the needle marks, hiding the dermal scars, etc., which will be there because of the injections. That is the reason. Usually, in the unusual areas, also there will be the tattoos, like maybe behind the neck, or maybe on the a whole from starting from the shoulder up to the palms, etc., etc. So different areas people have the habit of this particular tattoo marking. So that can also give you a hint that the person might have some addiction, etc. That is also helpful for the diagnosis. Many times the parents who bring that particular boy or a girl, because nowadays it is the youth who are more addicted. So parents do not know what is wrong here. So such way the physician has to develop the skills to identify what may be the reason behind his illness. Medical legal importance, it is a common drug of abuse, and heroin, it's as I told you, heroin, it is also called as brown sugar. And apart from that, you have the therapeutic purpose behind using the morphine, pethidine, and codeine. Codeine is used as a cough syrup. So many people, many youngsters take a codeine from the over the counter sale. So that is because it gives some again euphoric feeling. So it's a common drug even for suicide. So because people think it will give some painless death, that is how they opt for this particular opium. Accidental death already we have discussed because of overdose, etc. And also whenever the drug of addiction is taken, so overdose may be accidentally happening, so that also can be happening. And also wound botulism, there is one term called as wound botulism that may be asked in the viva. What is wound botulism? So what happens here is the wound is there on the body, isn't it, because of all injection, etc., or needle pricks, etc., which is done. And to that particular wound which is repeatedly given, that's why it's not in a in a physiological stage of healing. So here what happened, clostridium botulism, clostridium bacteria that will invade it, and because of that it will start releasing the neurotoxins as well. So that is why it is called as a wound botulism or clostridium botulism. So here that introduction of this particular neurotoxin to that particular wound areas will cause the flaccid paralysis. So that is why it is called as wound botulism. So it can be a viva question. And another is the cotton fever. They may ask you what is cotton fever and where it comes. So you should know that cotton fever is very common in the opium poisoning, and that anybody who is addicted with the opium. That is because what happens, this particular opium injections, they will be passing it through the cotton, okay, cotton plugs or cotton balls. So here because it is repeated, and during that time because they are passing it through this particular cotton, slight introduction of this cotton along with this drug into the body will cause the chills. It will cause some chills or febrile reaction in that particular person. That is why it is called as cotton fever. And apart from that, in pregnant ladies also, they have nowadays, uh, even in Western culture, because of the influence of the Western culture, etc., people are taking this heroin even in the pregnancy, and because of that there will be sudden infant death syndrome. And another word, terminology what will be asked in the viva is about body packer syndrome. Now what is body packer syndrome, they will be asking you, or it can be otherwise, you have another terminology called as body stuffing or parachuting. So here what happens, body packer is a person who will be smuggling all this, okay, whatever these drugs are there, he will try to smuggle it from one area to another, like cocaine, heroin, etc., etc., and he will start ingesting it, means he eats it, literally he'll be swallowing this particular wrapped packages, or it can be inside the condoms, or it can be in the balloons, etc. All that he is going to ingest. And he will see that his gastric motility will be very slow. For that he will take some tablets also, so that there should not be any motility of his gastrium or git should be quiet, isn't it? He has ingested it. By the time he reaches his destination, he should not pass it out. So that is why he takes some drugs which is going to slow down his gastric motility. And what happens many a times, it may all these things whatever he has ingested, or whatever he has swallowed, because they are packets, right, synthetic packets, so that is why there are chances that it may rupture. So because of the rupture there will be the toxicity, and many a times intestinal obstruction can happen, perforation also can happen, and all this may lead to the toxicity, sudden death possible. And apart from that, whatever signs and symptoms we have seen, no, that can also be there prior to the death. So how it is diagnosed, it is helped by through the x-ray. X-ray will tell you whether the drug packets are there, all these things. You can come to know by that also. And also, this particular opium is used as a illicit abortifacient, and it is punishment for infidelity, like vaginal administrative juice. This opium juice is introduced into the vagina as a punishment. Like if any lady or a lady is not sincere to the towards the husband, then the society can also punish. That is what their assumption is. So in that way they do all this nonsense. And apart from that, it is a cattle poison also. So here terms what you have to remember is uh, the terms what you have to remember is wound botulism, cotton fever, and body packers syndrome. And postmortem findings, very, not very characteristic, rather, because most of them we have already discussed. It is a euphoric type. All psychology aspects are more here, isn't it? So in physical, if any symptoms are physical, then only it will be showing in the postmortem. But here as such, not very characteristic, but you have a general idea. Like already we have discussed about the injection marks and dermal abscess, scarring, and yeah, these injections will be in the forearms, back of the hands, neck, groins, ankle, penis also many a times, and also the anti-cubital fossa is very very common. Tattoo to hide the marks, as I already told you. Face and fingernails are livid, and pulmonary edema, as I already told you, respiratory distress, isn't it? Among the three things what are very common, we had one thing as coma, another thing as pinpoint pupils, and another very important was the respiratory findings. So here whatever related to the respiratory findings, you have to write it. In general, you have an idea, isn't it? So such things you can write. And such things are actually searched by an examiner whenever he is correcting the paper. So if you have written something unknowingly also, you'll get the marks. So in that way, liver congestion will be there. Right side of the heart will be full of the blood, and left is empty. Congestion of abdominal organs. Bladder is generally full of urine, etc. So all these things you can write down. So that was about the opium, that is about the narcotic activity of opium. Now let us concentrate on two important drugs again. These are also very commonly asked in examination, written examination as well, bhang and datura. So organic deliriant poison. So what does that term deliriant mean? Deliriant means it is inducing talkativeness to the particular person. What type of talk? Irrelevant talk. And he's heavily talking. It's not like very simple talking. Sometimes, when we are tensed, we talk irrelevantly. It's not like that. They are talking irrelevant and very, very giant type or mega talking it will be. And bhang, let us concentrate now on bhang. It is cannabis sativa and cannabiaceae family. So you have the symptoms madika, as you know, the word madika, and matulani, vijaya. So vijaya term comes also in the shloka of upavisha. You remember, ahifena also is a upavisha. Vijaya is also the upavisha. Vijaya or bhang is also upavisha. So in English it is called as Indian hemp, and in Kannada, Bangi Soppu it is called. And habitat, usually it is wild, very wild in Himalayan or Kashmirian area, but all over India we are growing it. Again, as I told you, again it is like opium. Bhang also has the limitations of cultivation. Under the license itself, it is grown, and it is a tall, uh, annual dioecious herb. And these things, about the leaf, flowers, etc., etc., we need not very much concentrate when it comes to the Agada part, but you need to know it in as a general knowledge. So we have some common preparations here. So common preparations are like marijuana. The first one, the first heading is missing here. Marijuana it is called. So this is also called as Mary Jane, pot tweed, and grass, ganja, etc. So here it is the flowering tops which are crushed and used in the hookahs and smoked pipes or cigarette form and all it will be used. And another is ganja. So ganja also it is called ganja or ganja it is called. So here the extract of the leaves or bracts of the female plants they are used, and some people also consider the same term marijuana. This is also used in hookahs or pipes, and it will cause heaviness, lethargy, all these symptoms will be there in a person. Whenever you see the person, you come to know, okay, he may be addicted with ganja, etc. Because his eyes, that is the conjunctival suffix, will be suffused. Like the conjunctiva will be as if it will be coming out. So that type of appearance also will be there. So we have an idea, okay, fine, maybe he is addicted with all these negative dravyas. So another type of the common preparation is majun. So here it is a sweet meat. Like there is a preparation which is prepared with bhang, flour, and sugar and butter, and it will be sweet also. And it is said to have increasing the appetite and also the sexual desire, etc., etc. And bhang or patti or sabji or siddhi, that is another terminology used for another preparation. Here this particular thing also will be increasing the appetite, making him feel good. So that is the reason why people are behind this particular bhang preparations. And there is one term, as I told you, about hashish. Hashish is also present in the oil form, and it is also considered to be most potent. Another term for hashish is charas. Different modes are there or routes are there for the intake of the bhang, like for cigarettes and hookahs, or maybe along with the food, or maybe like cookies may be prepared, or some flour will be prepared, or it can be mixed with the milk or with any other drugs. Like tobacco is very very common along with heroin, etc. So or cocaine, etc. Also it can be prepared. The bhang can be used along with heroin or tobacco or cocaine, etc., etc. And as I already told, it's a potent uh, drug because of its constituent. The bhang is very potent because of THC. Now, what is THC? It is tetrahydrocannabinol. Tetrahydrocannabinol. THC. You just remember THC. If you're not in a position to remember the big term, you just remember it is THC. All the bhang preparations will be having the THC. Okay, and it is very high in the bracts, flowers, and the leaves. And apart from that, you have cannabidiol, cannabinol, cannabidolic acid. See, all something looking alike with the cannabis. So you can remember, at least you can try to remember it. And there are some other minor constituents also, like cholines will be there, spermidine will be there. If possible, you try to remember the major constituents, especially THC. You have to remember. Bhang, whenever you are telling, THC is a very common finding in the bhang preparations. And you have different uses also. Apart from the preparation, whatever we have discussed, we are also seeing it therapeutical use, because bhang is considered to be very, very potent medicine actually. Even for cancer, people are using it nowadays. So neuroprotection, inflammation, and antioxidant, etc. And they prepare ropes also, and paper also is prepared by this particular bhang because it is having cellulose, and it is antipsychotic. If you know visha, it is psycho active drug, isn't it? So if you're telling psychoactive, at the same time you should know it is like edge, two-edged sword. If it goes this side, it will be bad to the body. At the same time, if you are able to do all good shodhana and able to prepare it in the proper form, then it is a very good drug helping for the antipsychotic activity also. Okay, and rasa, as I already told you, visha, whenever any visha dravya is discussed, the same rasa panchaka should be depicted. Only some can be a exception. And rogagnata. Madakari. It is Madakari and Nidra Janaka also. And it can be Vajikara as well. As I already told you, it is going to increase the sexual desire in the person. So that is why it is a Vajikara Dravya. As such, if at all, it can be given therapeutically. And many dravyas like Jati Paladi Churna, Madananda Modaka, Vijayadi Vatti, etc. of our Ayurveda has this bhang. And Shodhana also is done. And Shodhana, it is boiled with a babula kwata for 3 hours. And powder is obtained and it is triturated with a godugda. And also, in the sense, the concentration of the Shodhana is towards the babula kwata. And you have to remember the bhang, fatal dose. What type of poison it is? It is a deliriant poison. So different parts are there, different preparations are there, like bhang, charas, ganja, etc. So ganja is 8 grams per kg body weight. Charas is very minimum, 2 gram per kg body weight. Bhang is 10 kg body weight. So in that way you have to remember this, like what you have done for the opium. Fatal dose is about 12 hour to 24 hour. 12 to 24 hours. Signs and symptoms. uh, Signs and symptoms like smoking. If at all, yeah, if anybody has smoked this particular preparation, then it may last for 1 to 2 hours, and it may set in half an hour after the swallowing, and it may last for 2 to 3 hours. Small doses affect very slightly, like very small doses are also taken, isn't it? But still, it gives an effect. It will include the euphoric effect, and people feel very high experienced, as if they are very like grandeur type. They feel very grand. And moderate dose, if at all they are giving, then it may have the impression on the memory function. If high doses are there, then it will be mark sensory distortion. So in that way, small dose, moderate dose, and high dose, because it is a drug of addiction, isn't it? So that is how you can classify as per the dose as well. And when it comes to the typical type of the this thing, our stages, two stages are there. That is, one is the psychiatric stage, and another is the narcotic stage. Two stage. Acute stage has two stages. One is psychiatric, and another is narcosis. Stage of narcosis. Stage of inebrium. It is also called as stage of inebrium. The first stage, that is psychiatric stage, wherein the person is going to show all his mental incapabilities. Then it is called as stage of inebrium, like visual hallucination, impulsive ideas. Very important here. You can see, go through all these words like talkativeness, uncontrolled laughters, sexual feelings, and speech changes, rapid, impaired, etc., memory changes, etc. The main predominant thing here is the person is going to go for the irrelevant talking. So here, irrelevant talking is there. The second stage is stage of narcosis. So that part is not seen here. Halfway it is. So this stage, it is physical. Totally, the person goes physical. Like the person will be having increased appetite. He will be having lot of thirst. He'll go for nausea, vomiting, and tachycardia, drowsiness, etc., etc. will be there. So in that way, the physical activities are more. That is the stage of narcosis, and the person may go for the failure as well, the collapse, and later the death may be there. Chronic poisoning, that was about the acute poisoning. Now chronic poisoning, as I told you during the opium itself, we have discussed. Here also the cannabis addiction will be there, and the person will be having anorexia, loss of weight, weakness, tremors, impotence, etc. And there is something called as hashish insanity. So here, chronic heavy abuse of cannabis causes the paranoid psychosis with a violent behavior. Person will go for the violent behavior, and increased susceptibility of the pharyngitis and bronchitis, asthma, and gynecomastia, etc. will be there in case of the of this particular thing. And mode of action. certain neurotransmitters will be affected by this particular bang. Certain neurotransmitters are affected, and that is how the symptoms are going to arise. Treatment, as already told you, the decontamination is very important, like giving the stomach wash, etc., etc. Supportive treatment has to be given, and whatever psychotic reactions are there in that particular patient, that has to be taken care. And chronic poisoning, psychosocial therapy has to be given. Like you have to see that the person is seen not to be again addicted, not to continue the addiction further. And diazepam for the sedation can be suggested. Later, you have to see that the person gradually is withdrawing from the drug. Of course, there is a methodology for that. Such a methodology has to be followed. And investigation also helps for the diagnosis, like urine test, and it is detected in the hair, urine, sweat, saliva, blood, etc. Medico legal aspects, as already told, accidental because of the overindulgence of the drug. And sometimes, these particular drug like marjun and charas, they are used by the thieves also, like to induce a robbery, etc. They will use it for to stupefy the people. Okay. And sometimes the criminals, they take because they don't want to be frightened, isn't it? To do a crime, to kill a person, they need some this thing, some strength they need. That is why to make an act before that, they will be taking this particular bhang preparations. And nowadays, it's very common to be there in chocolates, etc. And these chocolates can also give rise to all these problems, whatever we have discussed in the chronic poisoning, that can be there. And postmortem findings, as I already told, narcosis symptoms will be there related to the respiration as such. So usually the features of asphyxia will be seen. As such, not very, very specific. Next, we will be discussing about Datura. As already told, it is a deliriant poison. At the same time, neurotoxic, anticholinergic plant it is. So Datura metal, you have to remember it. Stramonium also, or Fastusa also. Different other varieties also there. But let us remember very properly Datura metal, because it's almost everywhere common in our area. And Kantakari or Solanaceae family it is. Datura means what? Dayati Shoshayati Dhatu Niti means it is going to have the capacity to dry the body. And at the same time, it is used for the asthma. It is very good to use its smoke, like the leaves of that particular plant. It can be used for the smoking, and it will be relieving the asthmatic attacks. That is the reason Datura is something which is used very near to the people, because it tackles the kasa, shwasa, etc. And it's a synonym mahamohi, that tells that it is having some this thing that influence is there on the mind. And in English, thorn apple, very common word is thorn apple. So this thorn apple, because it has got the thorns on its fruit. Varga, nowhere in Charaka Sushruta it is mentioned, very important. Bhav Prakasha tells it in the Guduchadi Varga, and it is Phalavisha Varga, because we talk about different types of Visha, isn't it? So this is Phalavisha. One second. And deliriant type, already as we have discussed, it is deliriant. And the it is a large herb, very common and looking like a weed. Where many areas it will be present like a weed. And you have got 5 varieties mentioned in Bhav Prakasha Nigantu, like Shita, Neela, and Rakta, and Lohita, Pita, likewise. Okay. And the fruits, as you can see here, they are having the thorns, isn't it? Or spiny fruits. They are large capsules, but in, and the kidney shaped. You can see that kidney shaped seeds which are present inside. Useful parts are seed, leaves, moola, etc. And many a times you see the Datura inoxia as adulterant in the medicine. So you have the chemical composition like atropine. Apotropin. It should be atropine. Okay, atropine, apotropin. So very common. It is atropine. You should be in a position to tell it atropine whenever when the teachers ask you about its chemical composition. Scopin, scopolamine, and hyoscyanin, hyoscine, litorin, valtropin. And Rasapinchaka, I will not discuss again. The only thing is the karma, which is very much oriented to the Shwasa, Kasa, and also the Jwara. Prayoga, you have different prayoga. Actually, it can be used for applications. The Patrasvarasa can be used in many, many areas, including the skin diseases. Shodhana, it is soaked in the Gomutra, kept for 12 hours, and it is transferred to the Dola Yantra for the Svedana. Then again, it is washed and it is dried, and the seed testa is removed. The fatal dose 600 mg to 1 gram, and atropine as such its own component, that is 10 to 100 mg of atropine, and fatal period is 25 hours. So as I told you, you have to by heart all this. You should not do any mistake in writing this fatal dose, fatal period, etc. Signs and symptoms. Initially, all these D's: dryness of mouth and throat, dysphagia, difficulty in speech, dilatation of the cutaneous blood vessels, dilatation of the pupils, delirium. So, all these D's you have to remember and you have to tell in the viva or maybe in the examination. Medico legal aspects, again, stupefying agent, and you can people mix it with the food or the smoke, etc., etc. And usually the passengers in the rail or bus, etc., will be the victims of the same. And it can be an accidental poison. This thing, um, accidental poisoning is possible because it is a weed, isn't it? So many a times what happens, out of curiosity, the children can eat it, and there will be overdose of the same. And the suicidal tendencies are there because it is easily available. Homicidal is rare. So in overall, it can be used as a addiction drug also. Postmortem appearance, because it is having atropine, isn't it? Whenever you are telling atropine, you should think about the wide all dilated things. So in that way, wide dilatation of the pupils will be there, lividity, well developed hypostasis, congestion in the internal organ. These are seen in the postmortem appearances. And treatment as such, the person should be in the quiet and dark room, stomach wash, purgation. And very important here is you have to write the antidote of this particular atropine, that is pyostigmin. So that is the one which is going to tackle. Along with that, diuretics and symptomatic treatment can be given. Now let me concentrate on cardiac poisoning. So we have discussed opium. We have discussed two things, that is bhang and datura. Now let us concentrate on cardiac poisoning. That is the karavira. So karavira is, again, as I told you, it is a upavisha, and it is also called as ashwamaraka, pratihara, hayamaraka. And you have got two sources here. One is Nerium odorum, or it is Tevesia nerifolia. This both these sources are important. Whenever you are in viva, you may be having only one or two specimens kept there. So both of them you can identify whether it is yellow oleander or whether it is Nerium as such. So both of them you should be in a position to identify. So varieties are the Rakta and Shweta, which is told even in Brahatrayi and Nigantu. Rajanigantu has told 4 varieties. Rasatarangini has told about 3 varieties. And Rasapanchaka, let me not again tell it because it is same. You can see here, isn't it? And in case of Shodhana also, Dola Yantra, Paka with the Godukta for 1 Prahara Kala, it is told. And there are yogas like Karaviradya Taila, Karaviradi Taila, and Vajra Taila, etc. So if you are asked in the Viva, you should be able to tell at least 1 or 2 yogas. Nerium odorum, let us discuss now the first source. So this is a very common plant which is grown in the garden. Many a times it is there near the highway, in the edges of the highway, etc. So very beautiful flowers will be there with the pink, dark red colors. It will be there, and lanceolate leaves will be there, and you can see the leaves there, isn't it? It is longer leaves, and the pods are also there, which many a times will open up. They are dehiscent type. They open up and they will be giving the seeds, and these seeds they will be having a hairy thing, isn't it? That hairy thing is called as coma, 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 tuft of hairs it is. That is going to help this particular plant seeds to travel far off places, and therein they will try to germinate and they produce the new plant there. So all the part of this particular plant is poisonous: root bark, milk, exudate, seed kernels, etc. The fertile dose is 15 to 20 gram, and leaves are 5 to 15. Important, 5 to 15, and fertile period is 24 hours. Signs and symptoms, locally one can just touch those particular exudate or maybe the leaves, etc. There will be contact dermatitis, and inhalation can cause head ache, dizziness, respiratory difficulty, nausea. If at all they are eating it, omitting, and pain in the abdomen, frothy salivation, difficulty in the swallowing and articulation, etc. will be there. The pulse will grow very slow. Later, see, all this impact will later lead to the fibrillation, atrial fibrillation, ventricular fibrillation, and AV block. So, in that way, the main impact here is on the cardia. That is why it is called as cardiac poison. And later, the death is because of the heart failure. What is the treatment? Treatment is the gastric lavage, and admission of the anesthesia can be necessary. Sometimes morphine injections can be given, and symptomatic treatment. See, all protection towards the heart is very, very important here. So symptomatically and especially cardioprotective activity has to be concentrated here. Postmortem findings, nothing very specific. As we already know, the petechial hemorrhage will be there on the heart, which is a characteristic feature. So petechial hemorrhage will be there on the heart, which is the characteristic nature. Medico legal aspects are, see, it is a plant, very, very common, isn't it? As we already discussed, it's a very common plant. That's why suicide can be common, okay? And accidental poison also can be common. And because it is used in the various treatments, so that is why usually people can use it irrelevantly. That is why the accidental poisoning is very, very common. See, there is one term in this particular slide called as love filter. Okay, love filter is a very common Viva question. Okay, what is love filter? Okay, what are the love filter drugs? They may ask you. Like, love filter is something which is given. Like, there is a concept of Vashikarana in Kannada, isn't Kannada, in the sense Vashikarana concept is there in India, right? So this Vashikarana is something you are going to give, and that particular lady or person, he starts loving you. So in that way, there are things which are given as to make a particular person be attracted. So in that way, one of the drug is this particular nerium odorum seeds, especially. And similarly, you have other drugs also, like alcohol, etc. Also is arsenic. So if somebody gives it, it means okay, fine. That will help that particular material. Will see that the opposite person will start getting attraction towards the giver. So increases attraction between the giver and taker. So that is what is called as love filter. Okay, that question may be there in your Viva. So you should be cautious about it. Cattle poison is another thing here, medical legal aspect. And very important is the nerium odorum, it is going to resist the heat, and that is why it can be detected even in the burnt remains of the dead body. Another species I told you, that is the Thevacea nerifolia. It's also the new name for Thevacea nerifolia is the Cerbera thevacea, and it is the yellow oleander. And you have seen it again. It's very, very common, and you can see the pictures, various pictures here. The seeds are there, the dried ones. Same Karavira synonyms, etc. Shodhana, etc. Everything is same here. The only thing is source is different. Active principles have the glycosides, especially as I told you, either alkalides or else more of glycosides will be there. So here this plant has glycoside, very oriented towards the cardiac failure. So glycosides, tevetin, tevotoxin, cereberin, and perovosite. See, tevetin is very, very powerful cardiac poison. Tevetin. So just remember the word tevetin. And apart from that, you can also concentrate on this fertile dose, that is 8 to 10 seeds, and 15 to 20 grams of the roots in the adult. Fertile period is 2 to 3 hours. Signs and symptoms: burning sensation will be there, dryness will be there, vomiting, diarrhea, headache, dizziness, dilated pupils, drowsiness, pulse will be weak, and blood pressure falls, heart block. Again, the same thing what we discussed in the Nerium odorum, heart block is going to be common. So, such things, whenever you write in the answer, when you are telling it's a cardiac poison starting, isn't it? And when you are telling about the signs and symptoms, you write it as AV block, heart block, etc. Okay, fibrillation. So such words you have to underline so that the examiner knows you know the pathophysiology there, what is happening into this particular body whenever the drug is taken. So that time you will get the good marks for the same answer. Treatment is gastric lavage, molar solution of sodium lactate to combat the acidosis, atropine 1 mg, because you're tackling with the heart there, isn't it? As I told you, cardioprotective activity has to be regulated. So that type of medicines have to be given there. Adrenaline, atropine, all these are emergency drugs actually. So all these are given so that you are stabilizing the heart, counteracting towards the heart block. And digoxin also very important, which is going to see that there are chances of the reverting of the cardiac arrhythmias. And symptomatic treatment are also to be given. Postmortem findings are signs of GIT irritation will be there, stomach and duodenum will be congested. At the same time, all the visceral organs, even the heart is going to be with the congestion. As we have told about the petechial hemorrhages, same will also be found in the uh, particular cerebera tevacia. So next we will concentrate on organic irritant poison. So these are also very commonly asked in the examinations. In the previous question papers, if you see, these are again highlighted there. So Arka, Ballataka, Jayapala, Snuhi, Langali, and in others, because why I have kept this side means these are the Upavishas. So Arka, Ballataka, Jayapala, Snuhi, Langali, Gunja I am not discussing, and others in the sense Eranda was there, and Chitraka is also there. Chitraka I'm not discussing. I'll be, because they are somewhat similar. You can go with the similar lines. Arca, Calotropis procera, and you have another source called as Calotropis gigantea, that is from the Asclepiadaceae family. As I already told, it is a Upavisha, irritant poison, and in Kannada it is called as yakke, or and it's a weed. As you all know, it is a good weed, and both this Calotropis procera and gigantea, both are weeds only. Gigantea is little bit different from the point of odor, the fragrance. The flowers of the Procera is having some fragrance, but when it comes to the other side, that is the Gigantea, they don't have much of the fragrance. So that is how we have a difference there. Apart from that, the color etc. will be somewhat similar, and Rasapanchaka, again the same one with reference to the Visha. And types, Gigantea procera, that is one part. Another type is Arka, Rajarka, Arka, or Shvetarka, Alarka. So in that way, the big variety and the small varieties are told even in our Nigantus. Yoga, we have lot many yogas like Arka Lavana is there, Arka Taila. So one or two yogas you can tell whenever it is asked in Viva. And root, bark, flower, leaf, latex, leaves. And if you are going to write it detail also, you may need all these points. So that is the reason I have put all this in the slides. Varga, Charaka, Sushruta, Vagbata, they have mentioned it in different Varga, especially Vedaniya, Vamanopaga, Svedopaga, Adobaga, and Arkadi Varga. And typical collection methodology is there for the arca. Like it has to be the root bark is collected from the old plants. Actually, we have to hunt for the old plants which are there standing in the hot weather, and the bark should not be removed as soon as it is dug out. Rather, we have to wait for 24 hours. Later, the bark has to be scrapped off, and the root bark is reduced to the powder. Like that, you have to use it for the therapy. In the sense, it is going to decrease the toxicity, isn't it? All these methodology is to see that arka, because it is upavisha, so it should not harm the person, isn't it? So that is why therapeutically utility, for that, not only the shodhana purpose, you also have to think about the collection and the storage. And toxic part, the whole plant is toxic, and especially latex of the same plant will be very, very toxic. Arka Shodhana is immersing in the lime water for 3 days and then removing and washing it with the clean water, dried and again stored. Chemical composition: caloctoxin, calotropin, ustarin, and galactin. Okay, you have two columns here. You can go through that. That is the Calotropia gigantea and the Procera. They have got similar type of the chemical compositions. Uses, as I told you, very good in different maybe arches, especially in fevers or different types of fevers, or can be in asthma, or can be in arches, or it can be in as to relieve the pain. And folklore practices for relieving the pain, actually it is wonderfully utilized. And signs and symptoms, you have three types. Like if at all the juice falls on the skin, then intense irritation. Already we told that it is a organic irritant. Irritant means what? It is going to harm the upper layer of the skin. Okay. Corrosive means it's in the next level. These are irritants. So the first layers, the initial layers of the skin will be harmed here. So here intense irritation will be there with the redness, and swelling will be there, vesiculation will be there. And if at all it falls on the eyes, then conjunctivitis will be there. And if at all somebody ingested, simply people have that habit of just cutting the leaves and simply chewing it. So such things also are very horrible things to be adopted. So here there are chances of burning pain, throat and stomach salivation, stomatitis, vomiting, etc., and leading to the death. Sometimes only because of irritation it can go up to the death also. And the fatal dose is not much determined. Now it can happen depending on the sensitivity of the particular body, because it is a irritable drug, isn't it? Irritable is depending on our prakriti. If vata prakriti or pitta prakriti, the irritation can be high, but when it come to the kapha prakriti, the irritation can be in the lower side. So depending on the person individual sensitivity or tolerance drug towards the drug, this can happen. And fertile period 30 minutes to 12 hours also it can take. Treatment is stomach wash, of course, irritant, isn't it? So stomach wash is very, very important. And in Ayurveda also certain things are told, like taking the Gairika water internally. Medico legal, accidental is very common because it is a weed and it is a therapeutic drug also. Malingering. See, this word malingering is very important. Malingering means what? Simply putting that particular drug on the body, and because of it, some wound will happen, isn't it? Like different injuries happen, bruises, abrasions, etc. And we are fabricating the injury, or maybe we are putting the same thing on the eyes and telling that, yes, I cannot come to the class today because I'm having conjunctivitis. So that is making a false appearance, making as to give excuses. We can make all these false malingering agents can be used to make a false impressions, and to escape the reality. So cattle poison also it's possible. Illegal abortifacient also it can be. Rarely it is a suicidal or homicidal agent, and it's a arrow poison as well. Okay, for arrow poison, if anybody asks you for arrow poison, what are the things we can use, you can give an example of this particular arka. And postmortem appearance, It is signs of irritation will be there in the stomach and the intestines, bloody discharge in the nostril and the mouth, congestion of the intestine and liver, spleen, kidneys, brain, etc. Heart is empty, trachea is inflamed. And next drug is Ballataka. This is also organic irritant only. But very common question which is asked about Ballataka. It is called as marking nut. You have to remember the word marking nut because initially it was used by the Dobie to mark the washed laundries. So it is called as marking nut. So in Viva they will ask you what is marking nut. You should be in a position to tell it is Ballataka, Semicarpus anacardium of Anacardiaceae family, and it is a moderate sized deciduous tree, and it's a shade giving tree. Very drier areas it will be present. And for identification purpose you can tell gray bark, that particular plant will be having the gray bark, and irritant red blaze resin will be there on incising, and that resin gets blackened on the exposure to the air, and it will be having hard leaves, and the fruit will be hard nut like. The nut actually is the toxic material here, and it is an organic irritant poison. Fertile dosage 8 to 5 to 8 seeds or 10 grams, 12 to 24 hours will be the fertile period. Varga, Charaka, Sushruta, Vagbata, Bhavamishra, all of them have recognized it, and they have put into the various Vargas. That is, Charaka tells it is Dipanya, Bedaniya, Kushtagna, Mutra Sangrahaniya. Similarly, Sushruta says Negrodadi, Mustadi, and Negrodadi, Mustadi, according to Vagbata as well, and Haritakyadi Varga. And bioenergetics or rasa is similar, like what we have discussed to all the vishas, and you have the rogagnata which is specific to the different parts, like ballataka phala is good in arshas, and majja is good in the klaibya, daha, ruchi, etc. And ballataka as such is good in the shofa, etc., krimi, etc. Varieties are there like Ballataka and Nadi Ballataka. Our concentration here is only for the Ballataka. Prayoga, good in, as we have told, Roma Shatana also it can be used. Roma Shatana also people were using it. And therapeutic dose, Taila 10 to 20 drops, and Kshira Paka is 30 ml. Constituents, very important constituents you have to remember here is semicarpol and bilavanol. Semicarpol and bilavanol. Others you can forget, but these things, semicarpol and bilavanol is very, very important. And apart from that, you can tell about bioflavonoids. Bioflavonoids. Irritant it is, isn't it? So homicidal is very rare. As such, nobody will try it. Accidental is possible because there are chances you will go near the particular plant to collect it. And oral is also very common. Many a times, it looks like geru bija. Okay, geru bija, the cashew nuts. So it is actually once it is also edible. The nuts are also the false fruits which are edible as such. So this there are chances that there will be blisters, etc., on the mouth or surrounding the mouth because of it. And it is also used as illicit abortion, and we have discussed this infidelity, isn't it? So like that, the punishment to the infidelity also it is used. Postmortem findings: blisters surrounding the mouth, throat, the mucous membrane of the stomach, congestion, inflammation of the GIT, fatty degeneration of the liver. Signs and symptoms: contact to the skin, it is irritation, inflammation, itching, vesiculation, and ulceration. Ingestion, blisters in and around the mouth, and severe gastroenteritis, hypotension, delirium, etc. will be there. So death possible within 12 to 24 hours. Meghanada Swarasa is utilized in case of the Ballataka, or Narikela Tailas are also can be used. Contemporary management includes symptomatic or supportive measures, and if at all the skin is contaminated, then you have to use the soap, water, etc. You have to clear that particular irritant, whatever is there on the skin. Stomach wash is better. Milk in GI distress can be given, and liniments also can be given for the blisters. Next drug is the Jayapala. So Jayapala is also organic irritant. So this is Euphorbiaceae family, and it is also a Upavisha, and it is actually not mentioned in the Samhitas, but most of the Nigantus tell it as Rechaka. Very important thing is it is used for the maladravana. That is to give a purging type of impact in the body. That's why in English it is called as purging croton. Purging croton. And it is a hedge plant. Usually this plant is a hedge plant, and very common also in India. And Rasapanchaka is like, as usual, like any other Visha, you can write it down easily. Chemical constituents is croton, isn't it? It's a croton. So you can remember some of the chemical constituents like crotonolic acid, crotonol, crotin. Likewise, you can also remember crotonoside, which is a glycoside. So in that way, one to four, if you can remember, please write down. And useful part is bija and patra. Similarly, it can be a toxic part also, especially the seeds and the seed oil are the very toxic, highly toxic parts they are. And Shodhana is told in Ayurveda, go dugdha by the Svedana into the Dola Yantra for 3 hours. And at the same time, even the Tankana mixed with the Jayapala seed, treated with the cow's milk, Svedana is done in the Dola Yantra for 6 hours. So any of such mechanism can be adopted. And you can just look through this particular Jayapala seeds, and it is very much similar to the Eranda seeds, isn't it? So many a times in your practical hall, you may have both of this, Eranda and Jayapala. So you have to look for the shine on the seeds. If at all it is shining, then it is called as Eranda. If at all it is not shining, then it is Jayapala. Very important. Even though you are going to rub it anyhow, Jayapala seeds are going to look dull. So, and it is very smooth also. The Eranda will be very, very smooth comparative to the Jayapala. And dimensions also, the Jayapala seeds will be little bit bigger comparative to the Eranda seeds. So that is how we are going to look into the difference of the Eranda and the Jayapala. This is a common question which will be coming over. Okay. And Prayoga, different Prayoga are there. Jayapala is also used for the Sarpadamsha, Vrishchikadamsha, Khalitya, Udara Roga, etc. And it is an organic irritant poison. And one seed is very enough to cause the toxic symptoms. 4 to 5 seeds will cause the death. Oil that is 3 drops is enough for the children. 20 to 30 drops for the adult. That is 1 to 2 ml of the oil. Fatal dose is 4 to 6 hours to 3 to 6 days. Signs and symptoms very similar to whatever you have seen in the irritant poisons. You can write the same thing, similar things. And treatment also is the same, like demulcent drink, like milk, etc. What we have discussed in the previous one. Same way you have to discuss for this one also. And when it comes to the Ayurveda, Dhanyaka Churna mixed with the sugar is given along with the curd, swaras of the lemon, tankana, etc. is indicated. Postmortem also the same methodology of writing you can adopt for the irritant poison. Here also the fragment of the seeds can be found in the stomach and the intestines. Okay, and medico-legal aspects, accidental, as we have discussed, suicidal and homicidal is very rare. Illegal abortifacient, and it is also a Arab poison, like what we have discussed for Arka and all. Likewise, for this particular poison, Jayapal also is a arrow poison. Shodhana, we have got 4 methodology of Shodhana actually. Different Shodhana is told in our classics. Any of one you can adopt. Next drug is the Snoohi. This is also organic irritant poison. Euphorbia nerifolia it is called, of Euphorbiaceae family. It is mentioned in Brahatrayi and Nigantu as well. And in Chakratatta, preparation of the Snuhi Kshira Kshara Sutra, because our Shalya Tantra people, they do lot of magic with this Kshara Sutra, isn't it? So Kshara Sutra, for that it needs some irritation. That irritation actually it should be there to heal the problem, or to cover that particular, or to overall cure that particular problem. So in that way, this irritant is positively helpful for us. But when it comes to the poison side, the irritation itself will be the problem. And in Kannada, it is called as kalli. Okay, kalli. It is called as kalli. Many plants are there. I will just go through different plants. I will show you in the next slide. So, Charaka, first chapter and 25th chapter, everywhere, Virechana is what is told. Like some people also call it as the Dravanti. And many varieties are told in Charaka. Like, two varieties are told in Charaka, Danti and Dravanti. Both are considered to be from the Snuhi aspects only. And it's this euphorbia, many varieties are available actually in our environment. So euphorbia nidifolia, nivulia, royliana, tirukalli, antiquarum, so different different types are there. This chemical composition wise, euphol, nirifolion, nirifolin, calcium mandalate, all these are very commonly poisonous for the person. And fatal dose is uncertain, and fatal period is 12 hours. And when, if at all there is contact on the skin, it will lead to the vesiculation. On eyes, inflammation of the eyes, and ingestion, irritation, vomiting, diarrhea, as we have already seen previously in other organic irritants. And management is stomach wash, symptomatic, supportive treatment, everything you have to see to tell that. Gogrutta, Chincha Patra are told in Ayurveda. And medico legal, homicidal is rare, criminal abortions possible, and pouring something to the eyes and as a punishment is possible. Accidental is very, very uncommon, not very common. Postmortem changes not very specific. Gangrenous patches are there because it is irritant, isn't it? So gangrenous patches may be formed in the stomach, and spleen will be in the rotten condition. This is one special thing here. So spleen in the rotten condition. Next drug is Langali. So Langali is a Gloriosa superba, Liliaceae family, and it is also a Upavisha. Okay, and in English it is called as Malabar glory lily. Because of its flower, it has this name. Gloriosa means it's very glorious flowers. So, and super flowers. So that is why it's called as Gloriosa superba. You can see the flowers and the root and the seeds as well here. Varga, it is mentioned in Bedaniya Vargas, it is there. So Charaka, Sushruta, Astanga, everybody has concentrated on this particular drug. There is something called as Langali Taila also, which is mentioned in Charaka, Sharangadara Samhita. And the chemical composition is colchicine alkaloid. And apart from that, there is gloriosin, superbin, salicylic acid, etc. And many drugs like Langalyadi Vati, Langalyadi Kulika, Nasya, etc. are there in our Samhitas mentioned. And it is also used therapeutically in different different areas, especially for easy delivery. Okay, for easy delivery, Langali is a drug of choice in the previous time to make the delivery of the pregnant lady easy. Lepa was done on navel, pelvis, vulva, etc. for the easy delivery. That is the reason many times it may go wrong also, isn't it? So in that way, even the Shodhana is also told. Gomutra is indicated, and Saindava, Takra, all these are also told. Milk is also there for the Shodhana aspect. Toxic part is the rhizome, what we have seen here, no, like the plow. You can see here on the in this particular picture, you come to know there is a plow like thing. That's why it's called as Langali. Langal means plow. So in that way, the toxic part is rhizome, and fatal dose uncertain. Lowest reported is of 7 to 26 mg of colchicine. Fatal period is also uncertain. We cannot predict because it depends again on the tolerability and permeability of this particular drug on the individual. Signs and symptoms is three phases you can consider here. Apart from all other, we have seen in general, isn't it? Or all organic irritant poison you have seen in general. But here it is told that colchicine poisoning, it has got three overlapping phases, like 10 to 24 hours, 24 hours to 7 hours. So 10 to 24 hours, what happens? It will be looking like a gastroenteritis. It will be looking like a gastroenteritis. 24 hours to 7 hours, what happens? Multiple organ failure will be there. Death can also happen. Multiple organs failure and death can also happen. If everything is all right, the person gets good treatment, etc., then what happens? Recovery is possible within a week of the ingestion. So little complications, of course, will be there because organ is affected. It is a irritant poison, isn't it? And toxic symptoms will encompass the numbness, burning in the mouth and throat, tingling, nausea, severe violent vomiting, diarrhea, pain in abdomen, ataxia, convulsion. See, multiple organ failure you have to remember here. Okay, so whatever is related to that, that every toxic symptoms you can remember here. And severe toxicity will lead to all organ failures, even including the renal failure, cardiotoxicity, hematological abnormalities, etc. Uh, and treatment as such, treatment as such in Ayurveda, some treatments are indicated according to Vaidyasara Sangraha, some Vamana, Virechana, fasting, etc. is indicated, milk, ghee, etc. is indicated. In modern aspects, perspectives, we see it as gastric lavage and regulating the blood pressure and monitoring the function of vital organs, because multiple organ failure is possible here. So every organ has to be concentrated here. You have to go for decontamination of the gastrium especially, and supportive treatment has to be given. And also the postmortem appearance will we have to think about in the angle of the irritation which has caused in different areas, like maybe inflammation in the stomach and intestines, and hemorrhages in the heart, the kidney, lungs, etc. So likewise, so you have to match the things. What type of poison it is? Likewise, the signs and symptoms will be there. Likewise, the treatment will be there. Postmortem appearance also has to match. Medical legal aspect, accidental is possible because it is a therapeutical drug, and criminal abortion because again it is used for easy deliveries, isn't it? And abort efficient also. That is how the accidental is possible. Even suicidal is also, though rare, it is reported. The last drug what we are discussing is Eranda. This is not Upavisha. So Upavisha, Chitraka, Eranda, and these drugs are not Upavishas. But of course, it has the impact of the Visha, because though we are using it in our daily routines, the oil is used. Oil is not having any poisonous content. The Eranda is resinous communis. It comes from Euphorbiaceae family. Very important thing is, what is poisonous here? Oil is not at all poisoning. Whatever residue has left after the oil extraction of the seed, that will be poisoning. So many times what happens in Viva, we may ask whether the oil is poisoning, giving poisonous effect. Some people will be in the confusion. So you should be clearly telling it's not at all the oil which is poison, but the residue which is left over after the oil extraction which is poisonous. Why it is poisonous? That is because of the resin. Resin is a protein toxin, okay, or phytotoxin it is, and it is water soluble glycoprotein and very very potent toxin found on word itself. Okay, very very potent toxin of the word resin, RECIN. Even the dust from that residue will start causing the irritation to the eye, nose, etc., etc. So even it is poisonous to the cattle. If at all that fodder is given, then it is poisonous to the cattle also. So you should be very careful of this particular resin. And purified resin is white powder, is inactivated by heating over 80 degrees C in the water for 1 hour. Symptoms if inhaled, ingested, or injected. So, inhaled means cough will be there, dyspnea, fever, respiratory disorders, and death. Ingested means nausea, vomiting, diarrhea. Like I told you, it is a organic irritant. So, likewise, dysfunction, all renal dysfunction, and death. If at all it is injected, resin can be injected. Okay. Initially, weakness will be there, myalgia will be there, vomiting, colicky pain in abdominal area, rapid feeble pulse, cold, clammy, or skin and cramps will be there. Fatal dose, lethal dose of resin for a man of 10 kgs is 6 mg, that is 10 seeds average. Treatment, you have to remove the poison from the body as soon as possible, maintain the organ function, and evacuation by stomach wash. And you can administer all supportive treatment like sodium bicarbonate, etc., in the intervals of 8 hours. Blood transfusion may be required because it may lead to the failure of different organs. And postmortem appearance, congestion, softening, and inflammation of the mucous membrane of alimentary canal. Fragments of the seeds are seen in the stomach and blood is seen in the serous cavity. So medico legal aspect, accidental is possible because people, children especially, they'll be playing with all these plants on roadside, isn't it? So many a times there are chances they will be eating these seeds. And seeds administered with the food, many a times accidentally, if at all the food contains this, because oil is prepared from the seed. So if at all the oil is not properly filtered, some mismanagement is there, then there are chances the seeds come along with the food. And homicidal also, that is possible to be doing it. Accidental is also possible, and homicidal also possible. And it's a local irritant as well for the skin, mucus, and eyes. So in that way, I think this is the last slide which I was taking up. So this is the conclusion. So Yogadapi Visham Tikshnam Uttamam Beshajam Bhave Beshajam Chapi Duryukta Tikshnam Sampadyate Visham. So it means that even the poisonous dravya, it can be a better medicine when prescribed through the proper yukti of the physician. So because there is no plant on the earth which is not at all a medicine. So for us, from the point of Agada, we are oriented towards the poisonous activity of the plant. Though we know we are using all these things in our therapies, we should also know that these plants have also harmed the society in different manner, accidental, homicidal, or suicidal, etc. So that is how our subject is concentrating on these particular things, and that is how the focus is on the forensic side of the plants. So forensic or medico legal importance is important here. So rather going towards the therapy side. So with this 10 drugs I could manage today to explain. I hope this has helped you students, and I also thank the team Panchajanya. Apart from that, I also wish you all the very best. Each and every child who is facing the examination should come out with the good marks. All the best.
Thank you so much, ma'am. Thank you for accepting our request and making time for us in your busy schedule. This session was very useful and very informative. Thank you so much, ma'am. We are
Thank you.
honored to have you today here, and we hope to make so many sessions with you in the further coming days.
Thank you so much.
Thank you so much, ma'am.